So, it's 2025. New year, new me, right? Well, I think it should be hashtag new year, new vaccine, new virus. If you're like me, you've probably put COVID out of sight and out of mind. But you've recently been walking around and seeing all the advertising from pharmacies saying, book now, the new JN1 vaccine. And you're probably wondering, what the hell is JN1? And what new variant of COVID are we up to? Well, I don't want to flirt around because it's no fluke, pun intended, that you've clicked on this video. So in this video, I want to break down two things for you. Number one, what is this new wave that is emerging? Is it going to become the new dominant strain? Should you be worried? Number two, if COVID keeps evolving with new variants, is it worth getting the new JN1 booster? If you're new here, my name is David Tong. I'm a registered pharmacist and I have over 15 years of experience across community and hospital settings. Before we dive into what the latest wave is, I thought it'd be good to take a little trip down memory lane so we understand how we ended up at where we are. So let's dive into the archives. We all know COVID hit in 2020 with its first iteration, which we termed Alpha. Alpha was quickly superseded by Beta, Delta, and Gamma. Then, like a Hollywood movie film, Omicron burst onto the scene and emerged as the dominant variant in 2021. Since then, I think there have been probably over 300 subvariants. Now, Omicron was an interesting beast because although it was much milder in symptoms compared to its parents or predecessors, it seemed to spread much easier. So, pharmaceutical companies quickly scrambled to rework the current vaccines so that they could target these genetic changes within the new XBB subvariant of Omicron. Now, earlier I alluded to Omicron having 300 plus subvariants, and the X in XBB is indicative of recombinant subvariant, which means somebody has most likely been infected with one subvariant of Omicron and at the same time infected with another subvariant. And these two subvariants have fused together or recombined to form a new subvariant, XBB. So if you see the word X in front of any COVID strain, you know it's recombinant, meaning two different subvariants have fused together. Now, let's fast forward to where we are today, the XEC subvariant. So current reports on the XEC subvariant show it does spread easily, but is no more lethal or harmful than current variants. The hospitalization data shows no spikes, so again, confirming severity of XEC is not something we need to be worried about. Common symptoms of XEC are very similar to other variants, with the big five being the most common: high temperature, headache, sore throat with a cough, body aches, and tiredness or lethargy. So that covers off a little bit on where we were with the start of the coronavirus and how it's evolved over the last 5 years to where we are today with XEC as the emerging dominant variant. So now let's talk about the second part, which is with its rapid evolution, will the current JN1 vaccine protect you from severe hospitalizations with COVID-19? And there are two reasons why I think the current JN1 vaccine will continue to provide great protection against severe COVID-19 implications. The first one I alluded to earlier, with the recent surveillance data showing no spike in hospitalizations, indicating the disease is one, reasonably mild or moderate, and two, that the current vaccines are actually working and protecting people from ending up in hospital. And the second piece is that Pfizer and Moderna have updated their vaccines to target the JN1 strain or type of COVID virus. And the JN1 strain is the parent of FLIRT and XEC. Furthermore, the previous vaccine based on XBB, an Omicron subvariant, should also be quite effective against XEC, given it has also come from that same lineage of Omicron subvariant. On top of that, Oral antivirals like Paxlovid, like Lagevrio, should also work against the XEC strain. If this information has been useful and informative, please give the video a like. It really helps the channel in educating people out there about pharmaceutical medicines and diseases in our community. Now, one thing that you may have found confusing about the COVID vaccine is it doesn't actually stop transmission of the disease. And generally, when we hear the term vaccine, we think of the polio vaccine, which does reduce transmission. Now that you know so much more about COVID compared to the general public, click here to learn whether COVID vaccines are safe.